Hello, I will be showing you how to perform a bed bath on a patient. Okay, first thing before I start, I'm going to ask the patient if he needs to use a bedpan. If he doesn't, I'm going to continue with the procedure.
7 steps.
And I'm going to say the 7 steps. I'm going to check the physician's order, wash my hands, identify the patient, explain the procedure to the patient, gather equipment, and provide for privacy. So, first thing I'm going to do is I'm going to take off the blanket. And for this procedure, I have a bath blanket. I have 2 washcloths, one to dry and one to wet, and a few towels. So I'm going to get the bath blanket on the patient, keep them warm.
I want to check the bag too for the date, make sure everything's fine, there's no holes.
I'll take off their gown. Make sure you cover them up as much as possible. Okay, I'll put the gown on the chair over here. Okay. I'm going to get my basin with my washcloths. Oh, for this procedure, I have gloves on. So I'm going to put my gloves on. First thing I'm going to do is get one of my washcloths wet, and I'm going to wash the face. I'm going to go from the inner part of the eye to the outer on both sides. I'm going to wipe the face, behind the ears, and the neck. I'm going to pat it dry. Okay, and I'm making sure every time I use a different section of the cloth. And the next part is the arm. I'm going to expose one of the arms. And I'm going to put a towel under the arm just to make sure I get the bed all wet. Okay. I'm going to wet the towel. Now I'm using soap. And I'm going to start from the tips of the fingers and go all the way down in long strokes and make sure that I pat it dry. Okay. I'm going to take the towel away and cover them up. Now I'm going to go to the torso. I'm going to get the chest, and I'll go under the breast with one swipe, and I'll be looking to see if there's any redness, and if there is, I'm going to document it. Okay. Now I'm going to wet this again, and I'm going to go to their abdomen. Maybe I'll cover them a little bit on top. And I'm going to check for skin folds and be wiping in between those. And I'm going to cover them up. Okay. Now I'll go to the legs. And the foot. I'm going to get my washcloth with some soap. And I'm going to wash the groin area. And I'm going to go down the leg. And then I'll get to the foot. And I'll go in between the toes. And on the bottom of the foot, and I may use lotion on the foot, but not in between the toes. Okay, now I'm going to do the same thing for the other leg. I'm going to cover them up. This whole time I also had a towel under here because otherwise it's wet. Okay, I'm going to take it out. There we go. Now I'm going to change the water before I move them onto their back, and I'll make sure I put the side rail up and leave the bed down, okay? So now I'm going to turn the patient so I get them onto their back. Put this arm here and this arm here. Turn them. And I'm going to put the towel behind them. Make sure we don't get the bed too wet. I'm going to expose the back. I'm going to wet the washcloth. And I'm going to wash the back. I'm going to pat it dry. And then I'm going to wash the buttocks from front to back. Okay, and I'm expecting for redness, and if there is any, I'm going to document that. Now I'm going to take the towel away and get the patient back on the front. And next I'm going to go to the perineum, but I'm going to change the water again. I'm also going to change my gloves. Okay, so I'm going to move the bath blanket up. And I'm going to probably have their legs up also for a female. And have the towel under here to prevent it from getting wet. And I'm going to wash. I'm going to wash the inner and then the outer. And then I'm going to take the blanket away. I'm going to move their legs back down. And put the bath blanket over them. If they're a male, they can probably wash the perineum themselves. So you want to ask them. And then I'm going to take all this, wash it, and I would change their gown. So this would be a fresh gown that I would put on them. And that will conclude bed bath.